As we get into the end of the task list, we're going to start talking more about ethics and client dignity and all the maintenance day-to-day things you do as an RBT. Your main role is implementation, but you're also there maintaining a certain level of respect and dignity for the people we work with, despite what population you're with. This question is asking, how do you do that? How do you best maintain a level of client dignity? Do you talk to your client using simple words and in small sentences because they have a disability? Now, just because they have a disability doesn't mean they don't understand what you're saying. It doesn't mean they can't communicate effectively. You should be speaking with your client, whatever level they're at, regardless of age, whatever their understanding is. That's how we should be talking to them. We should be talking to them like we would talk to anyone else. This is not a dignified way to speak to somebody, especially if they're cognizant of what you're saying and they understand what you're saying. A is not a great way to maintain client dignity, speaking to them differently just because they have a disability. What about B? Whenever you are working with your supervisor on treatment plans, you do not include your client because they are not trained in ABA. Now, that might be true that they're not trained in ABA, but part of a good client relationship and part of our ethical code is including clients in treatment planning. Now, you need to do this again to their level of ability, right? So if they're at 5 years old and they're a 5-year-old, they might not have as much say in a treatment plan. But if you're working with a 16, 17, 18-year-old, they have a huge right to what is and isn't being included. So you absolutely should try to include your client as much as possible in treatment planning. C, anytime your client uses the bathroom in the clinic, you ensure that a certain level of privacy is maintained at all times. Well, this is great, right? They're using your toileting or your potty training, whatever you're doing. When they're in the bathroom, you're making sure as much as possible privacy is maintained. You have to consider what you would want in that situation. If you're using the bathroom in the clinic, you want privacy, they do too. So ensuring that they have privacy is maintaining client dignity. So far, C is our best answer. Let's see about D. You talk about your client over drinks with some of your friends to brainstorm ideas. Should you be sharing information with your client, with your friends about your clients? No, you shouldn't be talking about your clients with people not on the team. Okay. If I were to talk about you with my friends behind your back, again, that's not maintaining your dignity. We're looking for respect. We're looking for a level of dignity. C is going to do the best job at maintaining dignity by ensuring privacy. First thing Liz does each morning is take a shower. She adjusts the temperature of the water so that it is steaming hot, just the way she likes it. The hot water serves as what? All right, so be careful here, right? First thing that comes to my mind, okay, is reinforcement, right? Every time Liz gets up, she does this. She adjusts the temperature of the water, steaming hot, behavior continues, right? It's reinforced. We're adding the water. Looks like positive reinforcement, okay? However, when we look at our answer choices, positive reinforcement is not an option. So we have to dig a little deeper, and that's going to happen sometimes on the test. You should be attacking the question. You should be predicting the answers, okay? But be prepared to not see your answer choice and have to go back. So we don't have positive reinforcement, but we know it's some sort of reinforcement, right? So we can eliminate positive punishment. We're not taking anything away. We're adding something. We can eliminate negative reinforcement. It leaves us with socially mediated reinforcement and automatic reinforcement. What's the difference? Socially mediated involves 2 or more people. It's social reinforcement. In this case, the only person involved is who? Liz. If there's only one person, okay, remember, automatic is one of our functions. This occurs when reinforcement is delivered by the person themselves, right? Nobody else involved. That is the case here. It is not socially mediated. It is automatic. We're looking at automatic positive reinforcement. Excuse me. Differential reinforcement teaches which of the following? Okay, how do we conduct differential reinforcement? Well, we reinforce what we want to see. We put what we don't want to see on extinction. Through differential reinforcement, what can we teach? Can we teach discrimination? Well, think about if you're teaching colors. I want to teach you the color blue. I put a blue card on the table and a red card on the table. If you touch the blue card, what do? I reinforce you. If you touch the red card, I put that behavior on extinction. I'm using differential reinforcement, teaching you discrimination. Good. So A is certainly something we can teach with differential reinforcement. What about differentiation? Now, differentiation is like discrimination, but now we're talking about responses. So a high five versus a fist bump would be a good example of differentiation. Same idea. If I want you to fist bump me, but you high five me, I'm putting that on extinction, right? If you fist bump me, I'm going to reinforce that. It's differential reinforcement. I can teach differentiation. I can teach both discrimination and I can teach differentiation. So the answer here is C, both. We can teach both, not neither. The CEO of an accounting firm wants to evaluate his employees' performance during tax season. He hands each employee a survey to fill out at the end of each week. The CEO then evaluates the responses. What type of assessment has the CEO conducted? What is happening in this question? We have a CEO. Remember, behavior analysis is not just for autism. That's what it's primarily used for right now, but we have other branches. And in this case, we're looking at some sort of CEO, okay, using behavior analytic principles to evaluate his employees' performance. How is he doing that? We know it's some sort of assessment, right? But what is he doing? Is he directly observing them? Is he interviewing them? Is he taking data? What's it looking like? Well, we see right here that he hands each employee a survey to fill out at the end of each week. That's a dead giveaway. This survey, right? Is it direct or is it indirect? Well, it's indirect. He's not directly observing his employees. He's letting them self-evaluate. He's going to evaluate the data, but he's not actually observing them doing anything. So we can eliminate what? We can eliminate direct. We can eliminate B. We can eliminate event recording. We can eliminate C. Are we conducting a preference assessment? No, there's no talk about what his employees like and don't like. He might do that after this one, but as of now, all he's doing is engaging in an indirect assessment. In order to determine what is and isn't reinforcing, you would need to perform what type of assessment? All right, more assessment questions. Assessment's important, okay? You need to know about indirect, direct, functional analysis, preference assessments. All of these things you have to be fluent on. In this case, we want to determine what is and isn't reinforcing. What type of assessment is going to give us that information? Be very careful here. A says preference assessment. Does a preference assessment provide you what is and isn't reinforcing? No. All a preference assessment does is tells you what is potentially reinforcing. It tells you what might be able to be used as a reinforcer. But you can't use a preference assessment alone to determine reinforcers. We need to know first, what effect do those preferences have on the behavior? What about an interview assessment with the client? Now, interview assessment, again, is a decent way to conduct a preference assessment. But just because someone says, oh, yeah, I'll work for this stimulus, doesn't mean the behavior is going to change. That's what we're concerned with. So we have to conduct a reinforcer assessment in order to determine what is and isn't reinforcing. Very obvious answer, but this is a question that you can overthink very easily if you're not careful. To determine what is and isn't reinforcing, we need to conduct a reinforcer assessment. A forced choice assessment is just another type of preference assessment, okay? A preference assessment is going to tell them what they do and don't like. A reinforcer assessment is going to say this is or this isn't reinforcing. Greg writes the following behavioral definition. Several times a day, the client will become frustrated. Frustration occurs typically whenever a task demand is placed on the client or when an item is removed from the client's possession. Mom and dad will attempt to calm the client down by providing verbal praise. What is wrong with this behavior definition? Okay. Not bad, right? But there's a couple keys in here that just don't sit right, okay? So several times a day, the client will become frustrated. What's wrong with that? Can we measure frustration? No. Frustration manifests in several ways. Some people hold it in. Some people lash out. Some people get emotional. Some people eat. Some people escape. Frustration is a variety of things. And in this case, frustration is not operationally defined. Frustration is impossible to measure. We do have, right, possible functions, task demand, item removed. We have antecedents, again, task demand, item removed. We have consequences. Mom and dad will attempt to calm the client down by providing verbal praise, okay? So what do we think is wrong with this behavior definition? We don't think it's measurable enough. Do we have that answer choice? Let's see. A, it does not attempt to describe the function. Well, we have task demand, so escape, or when an item is removed from the client's possession, tangible. Okay, so we do have potential functions here. B, it is not measurable. That's what we predicted. No way can we measure this behavior consistently without an operation or definition of frustration. We shouldn't use the word frustrated. We should describe what the client does when the task demand is placed or when the item is removed. Don't just say frustrated. Describe what actually occurs. This behavior definition is not measurable. Read all of your answer choices. C, there are no antecedents listed. We already identified antecedents. And then D, there are no consequences listed. We identify consequences as well. Okay. The problem here is B, it is not measurable. You need to describe what happens and not just say the client became frustrated, the client became upset. What happens when the client becomes, quote unquote, frustrated or upset? Joanna is in the hospital with a broken leg. Nurses give her a button that she can press if she needs anything. Joanna, on average, must press the button 3 times before a nurse responds. What type of reinforcement schedule is Joanna on? Basic reinforcement schedules. Couple questions you can ask to make these questions pretty easy. First, are we dealing with responses or are we dealing with time? If we're dealing with time, we're going to be dealing with interval schedules, the I's. If we're dealing with responses, we're dealing with ratio schedules, R's. Joanna has to press a button. The reinforcement is based on how many times she does that, so a number of responses. We can eliminate C and D. Now we ask ourselves, is this amount fixed so it doesn't change? Or does it change? Is it an average? Or right in the question, it says Joanna, on average, must press the buttons 3 times before a nurse responds. So what type of reinforcement schedule is she on? Is it fixed or variable? What's variable? It's an average. Is it ratio interval? It's a ratio because we're dealing with responses. And then we have 3 times. We have our 3. Our answer is going to be VR3. Every time while you're studying, break down reinforcement schedule questions that way. You have to break this stuff down to make it simpler for yourself. Once you get better, it becomes easier. Okay. We're not in a rush though when we're studying. We're just trying to get the right answer every time. Okay. I'd rather you do 5-10 questions in an hour and get all the answers right or review them rather than do 30 questions in an hour, get half of them wrong, right? You're going to learn more going slow and reviewing. Okay, your BCBA asked you to find the average frequency of name calling from your client. Monday, your client called 5 different people a name. Tuesday, the client didn't call anyone a name. Wednesday, the client called 10 people a name. And on Thursday, the client called 0 people a name. What are we doing? Finding an average. How do we find an average? Well, we need to add up all of our data points. So we start with 5, right? Because we're looking at name calling. Monday, we had 5 times. Tuesday, we had 0 times. Wednesday, we had 10 times. And on Thursday, we had 0 times. Now, how many data points do we have? Well, we had Monday, Tuesday, Wednesday, Thursday, 4 data points. We divide 15, which is the total, divided by the number of data points, 4, and we get 3.75. There's no trick to averages. You just need to know how to find an average. Okay. If you don't know how to find an average, just work on it. It's very simple. Okay. But there's no trick to average questions. You should get, these are the easiest questions on the exam almost. So you should get these right. Just make sure you know how to do it. I'm a BCBA and I'm explaining to a parent the current progress of a skill we are targeting. If I tell the parent that the skill is trending down, what am I really saying? Think about our graphs. We have our line graphs. We have our data path. That data path can do what? It can go up. It can trend up. It can go down. It can trend down. Or it can stay steady. It can flat. No trend, right? If I tell a parent the skill is trending down, what is that data path doing? Well, it's moving in a downward direction. So those data points are going downwards, okay? If we're trying to increase a skill and the skill is trending down, what are we really saying? The scale hasn't changed. Well, the scale is obviously changing. If the data path is going down, our data points are changing, okay? So A is out. So it's really about, is the skill improving or is the skill getting worse? Well, if we are targeting a skill for increase, if the skill is improving, that trend line is going to be going up. Okay. If that trend line is going down, what I'm really saying is the skill is getting worse. Okay. Now, is that true always on every line graph? No, typically you'll visually analyze graphs. All right. But in this case, if we're targeting the skill for increase and our skill is trending down, the skill is going to be getting worse. And then finally, which of the following answer choices will be the worst way to attempt and identify client preferences? Okay, client preferences, we just covered, right? It's what they do and don't like. It has nothing to do with reinforcers. All it has to do with reinforcers is potential reinforcers. We're just trying to identify what the client does and doesn't like. This question wants us to find the worst way to do that. So A, ask the client what they like and don't like. Now, that's a pretty good way of finding out what they like and don't like, right? Someone asks you what you like and don't like. You can tell them pretty much better than anyone else that answer. So A is pretty good. I bet we could find a worse one. B, ask the client's parents what they like and don't like. Now, this is also a way to identify client preferences, but on the exam, we're looking for what? We're looking for the best answer. So far, A is going to be better than B, right? So B is still our worst way to attempt and identify preferences. B right now is our answer. Can we find a better answer? And be careful, right? Because we're looking for the best answer, but the best answer of the worst way to attempt to identify client preferences. So far, that's B. Conduct a naturalistic assessment. So you're actually observing this client with stimulus or stimuli. That's better than just asking them the indirect way. And then D, buy several items and present them to your client and record how they respond. Again, a direct assessment is going to be better than an indirect assessment. The worst way would be asking the client's parents what they like and don't like. Again, still a viable way, but out of our answer choices, we're picking the best one. B, ask the client's parents what they like and don't like. Okay, thanks for watching. Check out rbtexamreview.com. 3 practice exams, a task list study guide. Combo pack comes with everything, and of course, our competency study guide as well. Questions, comments, please let me know. Love to help. Other than that, work hard, study hard,